Good morning. My name is Soteria Cobb, and on behalf of the San Bernardino County Medical Society, I'd like to welcome you to this early morning's webinar presentation, Telehealth Solutions for Your Practice. This webinar is being recorded, and during this presentation, we invite you to submit questions by clicking the chat in the control panel visible on your screen. We will address as many of these as possible at the end of this session. Now I would like to introduce to you our presenter, Tim Hoy, President and CEO of Aloma Medical Practice Management. Tim founded Aloma because he recognized the many challenges that doctors face in keeping their practices solvent. Now I would like to turn our presentation over to Tim.
Thank you so much, Soteria, and welcome to this morning's webinar. Janice or Soteria, if you'll allow me to share my screen, that would be really helpful, and I'll put a little bit of a short presentation to kind of show, introduce you to Aloma and introduce you to this morning's presentation. Give me just a second to pull that up. Okay. Well, again, my name is Tim Hoy. I'm the president of Aloma Medical Practice Management. Welcome to our webinar this morning. Aloma is the local office of the nation's largest network of medical revenue management companies. And we are so proud to be a business partner of the San Bernardino County Medical Society. Real briefly about Aloma, our mission is to help practices become more efficient and profitable. Another way to put it is that we help save doctors time and money. And so doctors and office staff, if more time and more money is something that you're in need of, we can help. What we do is we come in and we perform a thorough practice analysis to kind of pinpoint exact areas of improvement and areas of efficiency. And you know, we have a saying that we will not come in if we can't tangibly show you how we can help you in your practice. We offer a full suite of services, and here's some of the services that we offer. Our big one is this electronic health record, EMRX. Our company also offers certified coding reviews. We help you with collections if that's needed. We help you stay compliant, HIPPA compliant. We also, Audit Guard is our program to help you with audit mitigation. But this morning I want to focus on probably our bread and butter. Our big service is this iClaim. It is our medical billing service. And doctors, if you've not considered outsourced billing before, studies have shown that outsourced billing will actually be a lot less costly for your practice. Our company experienced a rejection rate of 2% or less. And so great track record, you know, over 20 years that we can show you to speak of. And so if you experience that kind of success with your billing, you might want to give us a call, help us, see if we can help you out. One of the things that is very different with our medical billing is that there's full transparency. A lot of billing company, when you outsource, they just take the work home and you don't really, you know, you don't know what they're doing. With our software, with the iClaim software, you actually have access to it 24/7. So you see exactly what we're doing, what your patient accounts are at. There's that full transparency, and also the money comes directly to you. We don't touch it. We just bill you for after the service is completed. So that's the kind of transparent, cost-effective services that we offer, and I would love for you to give us a call if that is an area of need. But this morning, I really want us to focus on, let me scroll up here real quick. So this morning, our webinar is going to be focusing on our new partner, Bloom Telehealth. As you know, the pandemic have changed a lot of situations. And, you know, while some of us may be kicking and screaming into this new era of telehealth, Bloom has put together a model that is really powerful. And they're going to show you how using this platform, you can actually substantially increase your practice. And so this morning I have Eric Auger, corporate support, and then Steve Clark, who is the CEO of Bloom. And he is going to be introducing you to this platform and how to use it to make your practice more profitable. I want to encourage you to stay tuned until the very end of the presentation because we're giving away a couple of books. One is a little booklet that, you know, if you're interested in implementing the Bloom Telehealth, it has a step-by-step process, a healthy virtual practice in 5 easy steps. It lays out the financial model and everything for you. And then I also have a book by Dr. Vicki Ragnar, one of our partners, called The Myth of the Rich Doctor. It's basically a financial introduction to financial realities that doctors face today. It's a very interesting reading, doctors. And so you might want to, this might be something that you want to add and check out. So with that, again, so stay to the very end and I'm going to share with you how to obtain those. With that, I'm going to go ahead and introduce to you Mr. Steve Clark, who is the CEO of Bloom Telehealth. So I'm going to stop sharing my screen. Steve, if you want to start sharing your screen, the show's yours now.
All right, wonderful, Tim. Thank you so much. I appreciate that. And it's a pleasure to be with you guys this morning. I was just talking to Tim and Soteria a little earlier, and you guys are up early there on the West Coast. And so we appreciate your time. And I'm going to go ahead and kind of walk through. We did another presentation for the groups there in California. It's probably been about a month and a half ago now. And Tim reached out and said, hey, Steve, we've got some new folks that are going to be on our webinar and just wanted us to kind of introduce you guys to Bloom. And we're actually going to share some additional information with you guys today that we didn't get a chance to share with the other groups. And so hopefully it's beneficial to you. Tim, can you guys see my screen okay?
Not yet.
All right, so let me see if I can go back now. Bear with me here. Screen sharing. All right, is that better?
Yes, we see it now.
Okay, so let me go ahead. All right, and so, you know, I know you guys are probably very familiar with telehealth. It's been around for many, many years, and really ever since the COVID-19 pandemic has it really come to the forefront. You know, Bloom, we got our start as a telehealth platform about 6 years ago. You know, we were working primarily in the post-acute setting all across the U.S., providing virtual care services. And when we talk about virtual care, it has kind of made a transition. You know, it has gone from your in the early days, kind of a store forward kind of sharing information to basic video chat. And adoption has been slow. And it has only begun to gain traction as reimbursement has changed in each of our states with all of the state mandates that are now being put in place for telemedicine. And then obviously with COVID-19 and the need to provide virtual care services to patients, everyone in the country is pretty much now looking at their virtual care strategy. And so, you know, Bloom, we have been in this space for quite some time. We have kind of watched it mature. And that was well beyond just a video chat. You know, the ability to connect with a patient and do a video visit. You know, Bloom is looking at telemedicine more as a virtual care program, right? So this is going to really need to, and as you guys begin to look at your virtual care strategy in your practice, and Tim kind of talked about the document that he's got to share with you guys, you really need to begin to look at virtual care from an enterprise or a global perspective. You know, what does it mean to your patients? And I think that's what hopefully you'll begin to see that Bloom is offering through this particular platform as we move ahead. We like to say that Bloom is one virtual care application with unlimited healthcare connection and endless possibilities. You know, our view is, you know, we've kind of taken the approach that, you know, we wanted to create a platform that allowed every healthcare professional kind of to come together as a community where care was patient-centered and enabled all stakeholders to collaborate for better outcomes. So what does this mean for you guys as individual providers? Your patients more than likely have got multiple caregivers within the community, especially the senior adults. You know, they typically would have their specialists, they have their primary care providers. A lot of times they might be visiting or having home health that needs to be included in that continuity of care. If they've recently had a hospitalization and now they've gone into a rehab facility, the ability to have a virtual care platform that allows for the continuity of care, the collaboration, and the ability to participate on virtual sessions collectively where that patient is centered is going to become very important. You know, we work with hospital systems around the country, kind of helping them develop their virtual care strategy. And, you know, if you're a hospital system, it's really about connecting and keeping those patients in your system. But if you're a primary care provider, being able to communicate through one common platform with all of the other groups in the area becomes more important to you. And that's really what Bloom is built on. You know, we're kind of built on this social networking architecture that allows you as a medical provider and a practice to build and create your own virtual care network. Okay, so you can connect directly to the post-acute world, right? If you need to follow your patient into the post-acute setting after a hospital stay, you can use the Bloom platform to do that. Even to the point of listening to their heart and their lungs, getting vitals shared with you over the platform, and becoming more integrated in that process. You know, we work with doctors all over the country that have patients that go into that post-acute setting and they just don't have the ability or the time to go see those patients once they enter that facility. Well, Bloom can help facilitate that. And then you have those patients that you're concerned about, you know, those patients that that are dealing with diabetes and hypertension, maybe chronic heart failure, COPD, and you really need to have a more integrated clinical approach to follow them at home, right? So Bloom is going to give you that ability to connect with that patient when they can't come into your office. You know, during a COVID-19 pandemic, that's perfect to do those virtual visits, but it doesn't stop there, right? You need a telehealth platform that's going to allow you to go beyond the virtual visit. You need to be able to capture that daily blood pressure or that weight for that cardiac patient that you're concerned about, right? And Bloom is going to give you that capability. And that's kind of what we as a software company and a platform are wanting to make sure that we're providing for our physician partners throughout the country is, you know, yes, we want to do a video visit, but virtual medicine is so much more than that. So, you know, we've designed this so that we can, I'm trying to minimize my screen here, guys. We really wanted to kind of disrupt the current market and allow all stakeholders to collaborate through one platform. So let's talk a little bit about chronic disease challenges. And this is something that Bloom can address. You know, we've talked about the virtual sessions, the ability to very quickly schedule an appointment with a patient to do a virtual chat, okay? And the platform allows both the patient and the clinic to schedule those consults. You know, we interface with the electronic health records for scheduling. We share documents back and forth between the Bloom platform and your EHR. So the basic clinic functionality is already there in Bloom. You know, we have built all of that. We come from a clinical background. I myself have ran and managed medical practices in 18 states throughout the US over the last 26 years. So we developed a Bloom with a clinic workflow in mind. But now let's talk about moving beyond that. You know we can do video chat. What does it look like as far as a virtual care strategy? And this has been a fascinating study for us as a company, right? So 6 years ago, 60% of Americans had at least one chronic issue and 42% of them had at least 2. So when you look at those statistically, they have a pretty big impact on health outcomes, right? 12% of the Americans who have 5 or more conditions account for 41% of the medical spend. This was all back in 2014. Fast forward to 2020, 6 years. 85% of Americans now have at least one chronic disease, all right? 60% of these Americans have 2. So in 6 years, we've gone from 42% of senior adults in America with 2 chronic issues to 60%. That is a significant increase. So if you look at and I think most of you guys would probably agree with me, if you took your patient panel, right, let's say you've got 3,000 patients there that you are managing within your practice. I would imagine that your senior population is growing. I can tell you every day in America, 12,000 Americans turn age 65, right? So the senior population is increasing by 8% annually. So your senior population is growing, and the complexity is growing with them. And so the need for you to be able to continue to provide additional services for these particular patients within your practice is going to grow. And I think it's an area that you can increase your overall revenue for your practice through a virtual care strategy if you just had a technology that would support that strategy, right? So if we even took, let's say, if 25% of your practice were senior adults, and we know that 60% of those are going to have, 85% will have one chronic issue, which means they would qualify for virtual care services, remote patient monitoring. Most of you guys, I'm sure, are very familiar with remote patient monitoring. But the challenge you face is, how do I implement a virtual care strategy with remote patient monitoring and chronic care that fits within my normal workflow, doesn't disrupt my current staff, fully integrates with my electronic health record? What is the execution or my strategy to move forward with that? That's what Bloom is trying to fill, right? We want to be that technology partner that gives you those tools to make you efficient, to drive this additional revenue in your practice. I don't know if you guys have done your own financial analysis. The book that Tim shared with you a little earlier that he's going to give to you guys after this presentation will kind of walk you through the financial metrics of that. I would encourage you to take a look at that because these are numbers that are going to continue to grow, and it's a tremendous opportunity for you guys as medical providers to kind of leverage your existing patient base into a really nice financial stream for your practice. And at the end of the day, it's just better patient care. So this is just another statistic we wanted to add. Numerous studies support the value of remote patient monitoring for patients. This was an interesting study from Mayo Clinic. Mayo Clinic documented a 40% reduction in 90-day readmissions if they were to put in place remote patient monitoring. Okay, so when you look at the group, they had a control group, and 20% of the group was readmitted or visited the ED compared to 60% of the controlled patients. So just by placing a patient on remote patient monitoring, you're immediately going to have an impact on the readmission rates that are impacting the spend here in the US, right? I think last year we were at $36.5 trillion in medical spend, of which 48% of that is made up of senior adults. So the outcomes that are coming out of a program of monitoring and virtually taking care of these patients is pretty remarkable. which is going to really lead to hopefully more strategic partnerships with you guys in the community, with the hospitals that you work with skilled nursing homes, which are also now being penalized for readmissions. So there's some strategic things that you guys can do there as well. Bloom kind of takes two approaches to virtual medicine. You know, we are a virtual telehealth software where we can provide you a turnkey technology that would allow you to do not only your kind of virtual visits, but also go all the way to the bedside, okay, where we're tracking and monitoring from the bedside. Bloom also has a new division called Bloom Virtual Care Services, that if a medical practice doesn't have the personnel and does not want to hire and put a program in place themselves, then we will come alongside you and provide those monitoring services for you, and we share that revenue with you. So we have two different paths forward, and you guys as a medical provider really have a choice. Path one, I just bring all of this internal, I use the tools, and I manage my patients. Path two, or track two, I utilize Bloom's virtual care services group to partner with me to provide those services. And that's really the biggest difference. So when we look at the Bloom solution, we have medical assistants that work very closely with our practices to engage with the patients, enroll the patients, put them on the virtual care platform, manage the schedule of the virtual care components of your practice. So that means if a patient needs a virtual visit with you as a provider or one of your providers in your practice, we're going to manage that schedule, work with those patients on that. If a patient needs to be put on a care management program, whether that's chronic care management, remote patient monitoring, and even further, behavioral health intervention, advanced care planning, annual wellness visits, all of those can be handled through an outsourced relationship, or we come in and work with you to help you establish that structure within your practice. All of this is patient-centered, and you guys determine how we move forward with that, okay? Device-wise, you know, you can see this is a dashboard that is within the Bloom platform, right? And this central dashboard is going to basically monitor everyone in your practice. It's going to tell you, you know, if you've got, you know, you have 1,455 patients that are currently being monitored or managed through the platform. It breaks down your remote patient monitoring patients, your chronic care patients, your patients that are on behavioral health intervention, maybe advanced care planning. And then we can drill down into each category, list our patients, and it gives us a reading to tell us how this patient is doing. All of these devices that you see feed this dashboard in real time, right? So these devices are sent to the bedside or to the patient's home. Either you guys or Bloom would help get the patient established on these devices. We get daily readings, and then we manage accordingly. It's going to let us know if a patient is in good standing. If, in other words, their readings are good, it's going to tell us if they're critical. It'll tell us if they're non-compliant, and it'll also tell us if they're at risk. All of this driven through the Bloom Care Management Dashboard. These devices themselves do not even require a smartphone, right? Because what we know is a majority of senior adults, especially over the age of 71, a lot of them don't have smartphone technology. So Bloom uses cell-enabled devices, which means that the patient just has to plug it in, and we can get those readings virtually through the virtual care platform without the patient having to have a smartphone device. Very important for the senior population. So how does it work? And it's it's kind of an end-to-end solution, right? From your clinic all the way to the home, right? So Bloom is going to give you the ability for video chat, no different than this Zoom meeting that we're on today. Now we're going to incorporate the devices at the home or wherever the resident is. Could be an assisted living. If you have patients in a long-term care facility, they qualify for virtual care services. So that would be a nursing home. All of these patients qualify. And as we talked about before, the data is transmitted through the Bloom platform and then reviewed in the dashboard at the clinic on a daily basis. This kind of shows you've got your dashboard at your clinic, right? You can see the virtual session here for a virtual visit. You guys also have access to this dashboard, which is your care management dashboard that's built into the software, and then the devices in the home. We do have mobile apps at the home. If a patient does want a mobile app on their iPhone or on their Android phone or their smartphones, they can download the Bloom app. It's free to them. So you guys can actually hand this out to all of your patients. The Bloom platform has the ability to send out invitations to all of your patients to have them connect directly to you on your virtual care network. So all of that technology is built into Bloom, but it's very simple and easy to use. This is a closer look at the dashboard. We talked about this. This shows, these would be your patients in your clinic that are on remote patient monitoring. Right now, this is showing you have 23. If I clicked on this particular box, it's going to bring all 23 of my patients up here. It's going to tell me which programs they participate in. Remote patient monitoring, chronic care, behavioral health intervention, annual wellness visits. All of these would show up here in your dashboard. This is going to tell us what their health category looks like. They're currently in good shape. This shows me that this Gene Smith is critical. At this point, I can drill down into Gene Smith. I can schedule a virtual visit if I need to with Gene at this point. Maybe we're concerned as part of your nursing staff and we want to get the doctor to connect with Gene right away because Gene's blood pressure is 200/120. Okay. We're also time stamping the elements. You guys there that have already looked at chronic care and remote patient monitoring know that there's a time element to all of those. So we're capturing that as we go. This once again tells me my entire patient population who's participating. We've got secure messaging in the platform as well. This allows me to go between my screens. And of course, here's our mobile app for taking readings, or in the event that the patient does not have a mobile app, we can get those readings through the cell services. This is the virtual care platform that you would see once you do a virtual visit, right? Where you can connect. We have the ability to do audio and video changes here. What that means is we actually within Bloom have the ability to recognize any device, right? So in a nursing home or a distance site, there might be a digital stethoscope, right? So you can listen to the heart and the lungs. It could be an otoscope. It could be a wound care camera. You know, our technology can take any medical device and recognize it and bring it into the Bloom platform and allow you as a provider to utilize those tools from a distance. And as I mentioned to you earlier, we've got detailed scheduling, and we had contemplated doing a deeper dive into our platform with you guys today, but it would have taken a lot more time than the time allowed. So this kind of gives you a quick overview of what the dashboard on the e-visit screen looks like. So this is just a slide that talks about the CPT codes for reimbursement for remote patient monitoring and chronic care only. If you were to put a patient on chronic care and remote patient monitoring through the Bloom platform, your average, the national average reimbursement for CCM and RPM per patient is about $166 a month. So we talked a little bit earlier on this call, if you had 3,000 patients in your practice, and let's assume, you know, maybe 500 of those qualified for CCM and RPM. if you guys just had 100 patients on, you're generating an extra $16,000 a month for your practice. And you are using technology that can be delivered with an LPN or a nurse. This does not require a provider other than a final review of the notes at the end of the month. And so from a Bloom's perspective, as a virtual care technology, we're the company that are going to give you those tools that interfaces directly with your EHR to give you the reports that you need to get a claim out the door and to become more integrated with your patients at the bedside. So that kind of, I think, ends our kind of quick presentation and overview for you guys. I know we only had 30 minutes, Tim, and I think I have gone over by about 5 minutes. So I don't know, Tim, if you want to open it up for question and answer, or how you want to kind of end the call today.
Let's do that. Participants, if you have questions, go ahead and submit it via the chat and we'll kind of read it off. But in the meantime though, Steve, could you talk a little bit about the pricing for using Bloom? I think that's one of the best feature that Bloom offers, actually. As we look in the market, you guys are extremely competitive. So can you kind of share with us what is the cost, what is the subscription cost, and all those things?
Yeah, absolutely. And you know, Tim, since our last meeting, we have made a slight change in our pricing model that we're getting ready to make a release. Actually, there'll be a kind of a release out to all of our agents. The Bloom license, we have moved to a flat, all-you-can-eat fee on the license fee. That means unlimited virtual care visits, all of the tools, the scheduling, everything within Bloom at $45 a month per provider.
Wow.
Okay.
Yeah.
And that's only for a licensed provider that is going to bill for the service. Nursing staff all gets free licenses. The licenses are all free for the families and the patients. So it's just $45 if you use the care management modules. Okay, those are pay as you go. So for the utilization of the Bloom RPM module, for instance, so within RPM, that would be the devices, the device integration, the technology to track the devices. Bloom charges $11 per month per patient. Now your reimbursement for that, Tim, is going to be about $110. Okay. So Bloom's cost for the software per patient is going to run about 10%. Okay. For all of the other tools, chronic care management, behavioral health, all of those others are $6. They're all included, and you only pay for it as you use it. So if you had 100 patients on and you're billing and collecting revenue on those 100 patients, you only pay Bloom for the patients that is actually using that module. Right. And that's it, right? And so, you know, we're strictly a kind of a transactional based program. You know, Tim, if you remember early on, we had a smaller license fee and then a transaction fee per virtual visit. We had a lot of practices that were, obviously their virtual visits were going through the roof, especially behavioral health providers that might do, you know, several hundred transactions a month. And, you know, that would get pretty expensive if they had to pay by the transaction. And so we wanted to make this affordable, easy to budget for a provider, and this new pricing model. And we used a survey of all of our doctors around the country to kind of ask them, you know, if we were going to look at an ideal pricing model, what would it look like? And this is kind of what they've come back with. And so hopefully that answered your question. You know, it does give the providers the ability to connect with their patients no matter where they are. And so hopefully that answered your question.
Yeah, great.
Steve, this is Eric. I'm going to jump in there. Steve, you want to share on the pricing model, how it works if the doctors are using the Bloom virtual care services as well?
Yes, if a medical practice or a provider says, okay, Bloom, I really want to begin to monitor and manage my patients remotely, but I don't have the resources. At that point, Bloom comes in and our care management team comes in and we take ownership of the program. We are responsible for enrollment, patient engagement, monitoring, tracking, hardware deployment, hardware fulfillment, support, everything that goes with a virtual care program. And we basically come in and share in your revenue 50-50. Okay, so if your reimbursement for remote patient monitoring is $110 and you just don't have the resources to go and set that program up, and you say, okay, Bloom, I'd love for your virtual care team to do this for us, then 50% of that each month would come back to our team for the staff and the technology. That would include the platform and everything, and then the practice keeps the balance. So if we were to provide that virtual care overlay for you from a clinical perspective, then we actually would, rather than 10% of your revenue that would go to the platform, an extra 40% of your revenue would come for our clinical team.
If I'm a doctor considering that option, Steve, I would say, well, okay, what kind of healthcare professionals are you using on your end to ensure that our patients are receiving the highest level of care possible? Can you speak to that a little bit?
Yeah, and typically we're using, we have RN supervisors, okay? So our clinical oversight for our call center is managed by RN level clinicians and some physician oversight that helps direct that group. But typically you're looking at an LPN level professional in our call centers. These are typical medical assistants or LPNs that have worked in medical practices in the past, and then they come in and kind of use the Bloom tools and our protocols to manage this patient population. So they are a clinical skill set. And this all qualifies for CMS from a compliance standpoint. And so those are the level of it, and it's probably, Tim, the level that they would utilize in their own practice, yeah. Right? So if we were going to come in and consult with any of the groups there, we would recommend an LPN level professional to provide this oversight. Mm-hmm. And please note, Tim, at the end of the month, all the clinical notes and everything goes back up to the doctors for their oversight and review. And so there is a level of engagement with the providers, with our staff, but it's minimal. Where it's going to be most needed is when we have those patients that are out of range that we're concerned about, and we need to hand off back to the doctor or one of their mid-level providers in their practice.
Okay. And what hours are available if we would employ that service? If let's say I'm a doctor, I have a medical practice, and I want to use that service, what office hours can my patient expect to receive care virtually from Bloom?
We are required to provide 7/24 availability to the patients. Wow. Okay. So even in the CMS requirements, the patient has got to have the ability to reach a medical professional at any time. And so in essence, we kind of become an on-call group for those patients that are participating in that program. Okay. A lot of times patients will have issues after hours and weekends. And a lot of our practices say, hey, we're not available. We have practices that don't even open on Fridays. And so, for a patient that's got a chronic issue, sometimes it can become problematic if they can't get access to a medical professional when they need it. And so the simple answer is we're available 7 days a week, 24 hours a day for those patients.
Yeah, that's amazing then. So just to think that if I'm a doctor, by just partnering with Bloom, I have essentially increased my office hours, my capacity to see more patients, And so this is so much more than just a platform that you're offering.
You know, it really is. And that's what we really have talked to our medical providers about. And that is what, you know, telehealth, telemedicine is much more than a video visit, right? It is becoming a new paradigm shift in the way that medical groups are practicing, right? If most of your medical groups there and you physicians on the line did a real deep dive to really determine how many of your office visits were maintenance related or follow-up visits, right? Medication refills, you know, your annual wellness type checkup visits, you know, your acute visits are probably not as great as they once were. You know, you're doing a lot more health management now. A lot of those visits can be moved over into virtual medicine, right? We talked about this on our first call, Tim, where, you know, most doctors will write a 90-day order so that they're not constantly having to have the patient come in for a follow-up, right? And if a physician just takes that 90-day order and changes it to a 60-day order and does a virtual visit, they've just increased another 3 office visits annually for that particular patient, right? So I'm taking my existing patient population and I'm adding more volume to my clinic just by moving to a 60-day follow-up as opposed to a 90-day, right? And that is a virtual care strategy. That is a way, and it's probably better patient care. How often does a patient have, you know, their medication is not as effective as it was originally, especially those that are on blood pressure medications, right? Especially early on, right? You put a patient on one particular drug therapy and maybe they don't respond or they've got some negative outcomes on that particular medication. Maybe we're moving them from an ACE to a beta blocker, and we need to follow them a lot closer, right? That's where virtual medicine really, really comes into play. And so, yes, I mean, it is going to create a greater demand for access, right? And so having the right partner that gives you the technology tools and maybe even the clinical support needed on the backside, that is going to be the groups that really thrive in this virtual medicine world that we're going to be experiencing here over the next, you know, indefinite years as it continues to change.
And then kind of speaking from a patient's perspective a little bit too, Steve, you know, I mean, like, yeah, this is really helpful to the doctor, but from the patient's perspective, it's really helpful as well. For somebody like myself who's, you know, pretty healthy, but I'm on, you know, some constant care as well. Maybe a trip to the doctor isn't something that I would want to do, but now if I'm given the option to just, with a matter of a few clicks, I can kind of have a little bit of FaceTime with my doctor, well, then I'm a lot more likely to want to do that. And so I know a lot of doctors say, you know, I really value that FaceTime. And of course, that FaceTime is important as well. But the way that society is today, you know, we can't always have that FaceTime, but the next best thing may be that virtual visit. And the other thing that you often talk about too was that, you know, a lot of times the patient will call the doctor and say, hey, doctor, can you look at this? Or can you refill this prescription for me? And of course, you know, doctors are among the most giving of people, and they'll do that, you know, kind of free of charge. By moving to a virtual telehealth platform, all those encounters are documented, right? And they become billable. And so when we talk about helping your practices become more profitable and more efficient, we're not necessarily asking you to change a lot of habits here. You're already helping your patient, but you need to help your practice as well by making these encounters billable so that you bring in the revenue. And so these are the kind of things that Bloom and Aloma would love to come alongside of you, kind of show you with just a slight changes in the way that you approach patient care, it can substantially increase the revenue that comes to your practice.
Yeah, those are all great points. And I think, you know, Tim, and for you providers and you physicians that are on the call with us today, you know, one of the things about Aloma that really impressed us, and Tim kind of talked through this, we understand that running your practice is a challenge, right? And managed care has changed reimbursement over the past several years. It's becoming a little more difficult to manage your spend and when your reimbursement is being cut. And becoming more efficient. How do I take my existing patient base with my existing staff without creating a lot of change? How can I become more efficient and capture additional revenue and provide better patient care? And Tim has always kind of maintained that with me. He's always said, Steve, this is what we're trying to accomplish. And at Bloom, because we were where you are, right? We ran clinics. We have had physicians very involved in the development of this platform. We want you to understand that our goal is to help you become a virtually enabled practice. And as Tim said, you're taking calls. And what we know about patient engagement, and Tim started with, patients now getting comfortable with virtual medicine. Before the COVID-19 pandemic, there was a national survey done, and 63% of Americans said, hey, I would consider doing a virtual visit. Since the pandemic, that has increased by 28%. So what that's saying is, and as a society, we are a society of convenience, right? It started with ATMs where we no longer went to the bank. And then we have fast food and we become we look at our time and the time that we spend. And that becomes very important to us as consumers. And your patients are no different, right? And if you guys can effectively engage with the patients, conveniently provide them the technology that they need, take that phone call that Tim said and convert that into a billable encounter, then you're meeting the needs of your patients. You're available to them to provide them the level of service that they need when they need it in a convenient way, but you're also capturing additional revenue. And I think that's what Tim was trying to say. And that's really where the market's going. And we just want to be that technology tool to help you take advantage of that. And do it in a meaningful way that's going to have better outcomes for your patients and better outcomes for the community.
Great, yeah. And one of the things I appreciate about your service, Steve, and since the last webinar, you've added on quite a few more services. It's very impressive. I didn't even know that. I think one of the things that we, Aloma and Bloom, try to do is we try to level the playing field a little bit, especially for those small practices, and those big medical care practices. Somebody's doing this for that enterprise. But for that busy doctor, to try to put all this together, it's just not, it's not fair competition. And so by having Aloma come alongside of you or having Bloom coming alongside of you, you also have the capability of offering what all of those other bigger medical practices can offer. And so I really appreciate the ready-to-use service that Bloom provides. Let me do this, Steve. I'm going to share my screen again because I had promised a couple of books and I want to just let people know how to get it. Aloma is your local licensed Bloom telehealth agent. If this is something you want to implement for your practice, give us a call or send me an email, thoy@alomamedical.com, or if you want to call me, that's fine as well. You can go to alomamedical.com and find all of our contact information there. What we want to do is we want to send this book as a follow-up, A Healthy Virtual Practice in 5 Easy Steps. The things that Steve has talked about is available in this booklet. It even tells you, it even has form letters that's ready for you to send out to your patients to introduce you to Bloom. Very easy to use app, very easy to download, and it's free for all your patients. And for doctors, it's only a $45 per month subscription service. I can't think of a less expensive platform that offer all of that. So that book will kind of walk you through step by step on how to implement the virtual telehealth practice for your practice. Also, if you'll contact me and you would like a in-person one-on-one demonstration, Steve and I and Eric are available to do that as well. We can walk you through it a little bit more. And if you believe that Bloom is the right platform for you, contact us, and our staff will help onboard your staff. Again, walk through the process step by step. We're very, we're not just this drive-by company. We will actually come alongside your staff and walk you step by step, because we know how painful implementing a new platform can be. And then for those of you who are members of the San Bernardino County Medical Society, if you'll let me know that you are, when you email me, just mention that, and I will be glad to send you this digital book called The Myth of the Rich Doctor. A great read. It's available on Amazon as well, but I can give you a digital copy, and just really great things to think about, because as you know, as a doctor, you're not just thinking about providing medical care, you're also a businessman that is to take care of your business and your employees and everything else. And this book kind of talks a little bit about that, helps doctors understand the financial reality that they face with the practice, but also even their personal finances as well. So great questions, great conversations with another doctor. That is it for us in terms of our presentation. Sodaria, do you see any chats, any questions that we didn't answer? Anybody else have any questions?
No, I haven't seen any questions come up, but thank you so much, Tim, Eric, and Steve. And if any of you do have questions that are on the call, please feel free to email us at SBCMS or, Tim, and we can go ahead and get those questions answered for you. And again, the webinar is being recorded, and we will go ahead and have that up on our website, as well as we can go ahead and email that over to you once it is available.
Great.
So thank you so much, and I hope everybody has a great day.
All right. Thank you, everyone.
All right. Thanks so much. Thank you. Bye-bye.
Bye-bye.